Hello, I'm Lindsay Dakey with Emerge Ortho, and today I am joined by Dr. Will Silver, who is the medical director of EmergeOrtho-Triangle region. He also happens to be an orthopedic surgeon specializing in sports medicine. Today, we're going to be talking about shoulder replacement surgery and some of the frequently asked questions that Dr. Silver gets from his patients and potential patients. We're making an effort in this time to make information like this more accessible to our patients and potential patients. So with that said, let's dive right in. Thank you, Dr. Silver, for jumping on with me.
Thanks for having me.
Yeah, absolutely. Okay, to start out, tell us a little bit about how you got into sports medicine and specifically shoulder replacement.
So I think sports medicine is an easy one. It always appealed to me from medical school on. I always liked watching sports. I like skiing. I like participating in sports, and it just seemed like a natural progression for me to want to work with athletes, and I really enjoyed doing that. And so that's what led to sports medicine for me. Sitting on the Duke men's basketball bench, for instance, while they were playing during the season was a great joy for me while I got to do things like that. And sitting on the sidelines at NC Central football, those were just fun activities to do. Within sports medicine, people primarily focus on shoulder and knee surgery, and there's, ankle and elbow here and there. But for the most part, we focus on shoulder and knee type procedures. And I have partners who do knee replacements. I personally do not. I do everything in the knee but knee replacements. But as far as shoulder replacements and shoulder surgery, I do a lot of shoulder replacement. And in general, I like the shoulder. I feel like it's the most complicated joint that I work with. There's a lot of variability from person to person and from injury to injury, and it just keeps it interesting. Every rotator cuff tear I repair has a different configuration, so it's never exactly the same procedure, which is fun. It keeps it fresh. It keeps it interesting, and so shoulder replacements. I do literally every type of shoulder surgery, from working on infants all the way to elderly folks. And shoulder replacements are the sort of the procedure we do when people have arthritis, basically when they are generally in their elderly years.
Excellent. Okay, so I do have some frequently asked questions here, so don't mind me if I reference my notes a couple times. But to start out, what is the difference between a primary replacement, a reverse placement, and then replacements for fractures? Can you tell us a little bit about that?
Sure. So in order of those, primary replacement is a shoulder replacement that we do solely for people who have arthritis of the shoulder and in general do not have any problems with their rotator cuff. And so when you think of people with arthritis, that's typically what you think of and what we would use to replace the shoulder. And so a primary replacement is where you replace the bone ball part of the shoulder with a metal ball, and you replace the bony cup of the shoulder with a plastic cup, and then you reattach the rotator cuff, and the shoulder is essentially restored back to a normal smooth surface. A reverse replacement, secondly, is a replacement that we use in people who either have a rotator cuff tear or a fracture. And so in those situations, we typically think about a reverse replacement. So the difference is that in a reverse replacement, you put the cup on the ball side of the shoulder and the ball on the cup side of the shoulder. So it makes sense from a name standpoint, but as to why we do it, it completely bypasses the rotator cuff. So in a fracture or in a situation where somebody has a rotator cuff tear, if we do a regular replacement, it's not stable. The ball moves out of the cup, and it's painful, and you lose motion, and it doesn't work out nearly as well. So when the rotator cuff is torn and we put a reverse replacement in, it's the actual mechanism, the structure of the replacement that stabilizes the shoulder joint and allows the shoulder to move more normally and gets you better strength and better function, as well as alleviating pain. We talked a little bit about fracture a minute ago, but in a fracture, generally pieces that break are the ball, and if it's a worse fracture, there are two pieces of bone primarily that the rotator cuff attached to, and if those are broken away from the shaft or the stick of the bone, then you don't have a functional rotator cuff. And so by using a reverse replacement, again, we bypass the pieces of bone that the rotator cuff are attached to, and it restores the function of the shoulder. There are other types of replacements that can be used, such as a partial replacement, where you may replace just the ball part in a fracture situation and then try to reattach the pieces of bone that the rotator cuff attached to restore some of that rotator cuff action or mechanism. And in general, we found by clinical trials that reverse shoulder replacements work the best in that situation.
Excellent. Okay, so you went into a little bit about reverse replacement. So can you talk a little bit about the limitations that people who have this surgery have afterwards?
Sure. So it's pretty variable from person to person, how much motion and strength people get back after surgery. In general, pain relief is pretty common, pretty consistent. It's a significant improvement in the arthritis pain post-operatively compared to pre-operatively. Probably the biggest limitations I see are range of motion limitations. Strength generally is restored pretty well by nature of how the reverse replacement works, but motion is the biggest thing I would say. So if somebody's able to raise their arm all the way up or their head, ordinarily, with a reverse replacement, they might get 2/3 of that motion back. They can generally get their hand and elbow to and above the level of the shoulder, even with weights. So putting dishes away, for instance, is generally very doable. Putting things in your refrigerator is usually easily accomplished. But getting much higher than that's a little difficult. The biggest restriction, though, is reaching behind your back. People have a really hard time, most of the time, getting their hand much past their hip. I've got people who can put their hand into the small of their back after reverse replacements. And again, there's a lot of variability, but I tell most people that reaching behind your back is generally pretty tough. So getting into your back pocket to get a wallet out, or passing your belt through belt loops, for instance, are things that are somewhat difficult to do after a reverse.
Okay, so post-surgery, what does the follow-up look like? Follow-up appointments?
So usually we keep people overnight at the hospital, at least one night. Sometimes they need to stay longer than that. It can be done as an outpatient basis, so you'd leave from the day of surgery and go straight home, but most people stay overnight. Once they leave the hospital, they basically they stay in the sling. We don't want them moving the shoulder at all. Keep it pretty still, and they come back to see us in about 10 days to 14 days. It's not super important when that is, but generally a week or two after surgery, and we just want to check the incision and make sure everything looks okay. We don't really start physical therapy until about a month out from surgery, and so I usually see the patient back right around that time as well, about a month after surgery, and then I'll see them maybe every 6 weeks or so after that. They're in therapy for variable amounts of time, physical therapy that is, probably in the 3 to 4 month range after surgery. Some people a little longer, some people a little shorter. If somebody's coming into the office right after surgery and they're raising their arm right up to the ceiling and don't need therapy, then fine, no reason to send them. But most people probably do need a little bit of physical therapy. After the 4 month or so mark, I might see them at 6 months, oftentimes not. And then we either see them on an annual basis, either annual or biannual basis. So maybe a year out from surgery, or if they're doing great at their 6 month follow-up, I might see them 2 years out. But I'd say in general on a 12-month basis, just for a maintenance visit, make sure that everything looks good on x-ray and their shoulder's working well and all of that.
Excellent. I bet you get this question a lot. How soon after surgery can you shower?
So the way I typically do the closure, and yes, that is a common question, but the way we typically close the skin is actually with a waterproof type of an dressing. And so basically it's skin glue, but it goes on this clear mesh that's applied over the incision. So we put a little bit of skin glue on the incision itself, this mesh on, and then we put skin glue on. And so it's waterproof as soon as it dries, which is a few minutes after surgery. And so you can shower right off the bat. It's just a matter of keeping the arm quiet by your side, take the sling off, just let the arm dangle, let water run right over it. Don't put soap or ointment or any sort of medicine on it. But yeah, they can shower the day of surgery.
Awesome. Okay. What about driving?
So driving is a little trickier. There is no good legal answer to that question. You certainly have to be off your pain medication. You certainly have to wait until any nerve block that was given to you before surgery wears off. In general, I haven't seen any studies for the shoulder that show when people have regained their ability to operate a vehicle that give us any guidelines. So really it's just, I would say roughly a month or so, because you're in a sling for a month. At a month, if you can operate your vehicle in a safe fashion, you're probably okay to do so. There are no legal parameters, that stipulate when you can and can't get back. I think the thing I always tell people, just, pretend you're driving and a small child runs out in front of you, rides a bike out in front of you, and you got to avoid them or stop. And you just have to be 100% sure you can do so without any restrictions or limitations. Make sure not only are you safe from running into things, but you're not causing injury to somebody else, accidentally.
Yep. Good guidelines to go by. Okay, so what about keeping the incision clean post-surgery? Do I need to clean it after?
So again, with the waterproof dressing, we don't touch it. We just leave it on. It tends to peel up on its own from the edges after about a week or so. And so if that's bugging you, you can snip the edges that are peeling up if they're catching on your clothing or whatever. We like to take it off ourselves in the office. So once we take it off at that first post-op visit is generally when we do it. Once it comes off, in general, no, I don't like any sort of ointments or dressings or anything placed on it. Just if it's clothing or purse straps or whatever are bothering it, then you can put a Band-Aid over the area where they're hitting. But nothing special. It's once the skin glue dressing comes off, it should be pretty solid.
Excellent. Okay, another common one I bet is when can I stop blood thinners?
Okay, stop them. Usually we'll do about 2 weeks after shoulder replacement surgery with typically just with aspirin. There's lots of guidelines for lots of other types of surgeries in terms of what types of medicine and how long to be on them. But for shoulder replacement, there really aren't. And so what my practice is aspirin, cheap, easy to take once a day for 2 weeks. And then most people are able to stop it at that time.
Okay, great. Well, if you viewers would like more information about Dr. Silver or any of his specialties, you can actually click the link in the description of this video. It'll take you to his bio page, learn more about him, his specialties, his background, and you can also use that link to make request an appointment with him. Thanks for watching.